This podcast was produced by OAR FM Dunedin with support from New Zealand On Air.
Welcome to Disabled Persons Assembly's Notable Radio Show. DPA is a systemic advocacy organisation run by and for disabled people. DPA is a pan-impaired organisation with members across the country. Over the next half hour, we'll discover how we can work collaboratively to achieve inclusion for all New Zealanders. DPA's Notable Radio Show, a whole new attitude.
Kia ora and welcome to DPA's Notable Radio. I'm your host, Amy Taylor. Today we have some special guests from People for Us. We'll explain what People for Us is in just a minute. But we welcome Leanne to the studio.
Kia ora.
David to the studio.
Kia ora.
And Kira to the studio.
Kia ora.
Welcome, everybody. Now, just a heads up for our listeners, Kira lives with Tourette's syndrome and David lives with a learning disability. Remember, we are not defined by how we speak, so just be patient today in today's show. Right, to begin with, can you tell our listeners about People for Us and what it actually is and what service it's designed to do?
David, People for Us is an independent peer visiting service which disabled people living in houses funded by Disability Support Services. We visit to make sure people are living a good life, getting good support and are safe. We also assist people to raise concerns if something hasn't right.
Thank you, David. What stands out to me about this service is it's not just a check-in from a professional or an agency, but it's a peer visiting service. Can you explain what that means in practice? Who are the visitors and why does peer support matter in this context?
In this context, it means disabled people visiting other disabled people. We have a kaiarahi or a visit leader who is a disabled person alongside a kaiawhina or a visit assistant who supports the kaiarahi. The team then visit the disabled person living in the home.
Having living experience is really important to our work. It's build trust because people know they talking to someone who understand. It feel more like a conversation with someone rather than a view or a picture. Inspection, which is what we want to involve.
Thank you, David. Thank you, Leanne. So from what I understand, the visit is carried out by two people, a visit leader who is a disabled person and a visit assistant who supports the visit. I feel that's a really important model because it centres the disabled person in the process rather than making them a passive recipient of oversight. Is that the part that makes this service different?
Yes, it is. With our live experience, we want people to feel comfortable to tell us what is going well and what's not. We also not there to tell people how to live their lives. We there to listen first.
Thank you, David. I want to talk a little about the why behind People for Us. This service was developed following the Royal Commission's inquiry into abuse and care, which found that disabled people in residential settings have too often not been safe and not been listened to and have lacked independent support. Can you tell us about how these findings shaped the creation of People for Us?
Yeah, the Royal Commission showed us that too many disabled people weren't being listened to and in some cases weren't safe. The stories were really difficult to hear. People for Us was created because we needed a better way for people to speak up and be heard by people that understand.
Thank you, Kira. So it's rather sobering because disabled people in residential care can be in a particularly vulnerable position. They may depend on staff for immediate care, communication support, transport, medication, all sorts of things that most people take for granted. And if something isn't right, speaking up can be very difficult. Is one of the key roles of People for Us to create a safer way for people to raise concerns before issues escalate into serious harm?
Absolutely. Sometimes people just need someone independent to talk to. It might be something small that's been bothering them, or it could be something more serious. Whatever it is, we want people to know that they don't have to deal with it on their own, and to have people that will take action.
Thank you, Kira. The service seems to be more than just responding to crisis. It's also about checking whether someone is living well, whether they have choice and control, and whether the support around them is actually working for them. That feels very aligned with the broader disability rights principle that safety is not just the absence of abuse, but the presence of dignity, autonomy, and a good life.
Of course. We want people to be safe, but we also want to know if they're living the life that they want. Are they being listened to? Do they have choices? Do they feel respected? Those everyday things tell us a lot about how someone is really doing.
Another interesting part of this service is the way it was developed. My understanding that more than 420 people were involved in shaping this, including disabled people, tangata whakaha Māori, families, whānau and service providers. That's a significant amount of community input. Can you tell us about the development process and why it was important to build the service in that way?
Yes, this service was built with the community right from the beginning. That meant people weren't guessing what disabled people needed. They were listening and building the service alongside disabled people. People First New Zealand, which is run by and for people with learning disability, was then chosen to deliver the service. We've continued to grow and improve it by working alongside disabled people every step of the way.
Thank you, Leanne. That's very important. That kind of co-design really matters. Too often, services are designed around disabled people rather than with us. Here at DPA, we talk a lot about nothing about us without us. And it sounds like People for Us has really taken that principle seriously.
Yes, definitely. Co-design isn't something we do once. It's how we work. That's really important because the people using the service are the experts in what works for them.
Do you think that disabled people are more likely to trust and engage with a service when they know that it has been designed by disabled people and is being delivered by people with lived experience?
I think it does. Most people we're visiting are often more comfortable opening up and sharing their experiences with the kaiarahi, the visit leader.
That's very eye-opening. Please tell us about who the service is for. Who can receive a visit from People for Us?
This service is for disabled adults and tangata whaikaha Māori living in homes funded by the Disability Support Services.
So this is specifically for disabled adults and tangata whakaeha Māori living in homes funded by Disability Support Service. If someone is in one of those settings and they or someone around them is worried about their safety, well-being or quality of support they are receiving, they can be referred to the service of People for Us. Who can make that referral? Is it only the person themselves, or can whānau and others do that as well?
If one can make a referral, it doesn't have to be the person themselves. A family member, friends, an advocacy, support worker or provider can all make a referral if they worried about someone well-being or environment. Disabled Support Service wants us to visit every single person in the home they funded, which means we are also contacting providers to visit homes with the gold to visit everyone.
That's really important because often it's a family member, friend, advocate or support worker who first notices that something is not right. From the information on your website, it looks like anyone can make a referral, including the disabled persons themselves, family, friends, support workers and providers or others in their life. What happens after a referral is made?
We organise a visit with the provider or person living in the house. We make sure the person knows what to expect and that they feel comfortable with the process of how visiting their house.
Thank you, David. Can you walk us through what a visit actually looks like? If I'm a disabled person living in a residential service and People for Us comes to visit me, what shall I expect?
So the first thing you can expect is that we'll take the time to get to know you. We want to have a real conversation and make sure you feel comfortable. Our job is to listen, understand your experience, and support you if there's anything you'd like help with.
I imagine a big part of that is simply having the time and space to talk honestly about how life is going. When someone feels safe, whether they have enough choice and control, whether they're getting enough support they need, and whether anything is worrying them.
Yeah, we'll ask how things are going. Beans, sorry. What life is like, and if you're getting the right support. We'll also talk about the things that matter to you, because every person's situation is different.
And if concerns are identified, what can People for Us do? For example, if somebody discloses neglect, poor treatment, or something more serious, what happens next?
It really depends on the situation and what the person wants. Sometimes people want support to have a conversation. Other times we might work with whānau or services. If someone is in immediate danger, we'll act quickly to make sure that they're safe.
From the information available, it sounds like the team can take a range of responses depending on the situation, from supporting the person to speak up, to talking with whānau and advocates, to involving health providers, emergency services if needed, and even returning for another visit if follow-up is required. So it's not a one-size-fits-all process, but it's something that responds to the person's circumstances and safety needs.
Kira, did you perhaps want to give maybe an example of when we've visited someone and we have followed up with a pathway?
Sorry. We've visited people before who have particular hobbies that they haven't had the opportunity to engage with, for example, photography. And so we've helped them by getting them in contact with various groups and in the community so that they can have the support to pursue that hobby, which they might not have had the opportunity to actually do beforehand.
Oh, that's really cool. So it's not all about medical and health. It can be about social as well. That's very cool. Mm-hmm. One of the words that comes up in your information is safeguarding. That is a term people hear more and more, but it can be mean different things to different people. What does safeguarding mean in the context of People for Us?
Safeguarding is making sure people can live the life they choose. It's about respecting people's rights and making sure people get the right support.
The explanation on the website says that safeguarding is about protecting the person's right to make their own life choices, keeping people safe and well, and acting to prevent and respond to abuse, violence and neglect. I really like that it starts with rights and autonomy, not just risk management.
Yes, safety and choice go hand in hand. You can't say someone is truly living well if they're safe but don't have any say over their own lives. Good safeguarding is about respecting people's rights, listening to what matters to them and supporting them to make their own decisions while ensuring people are safe.
That feels very important because disabled people have historically been overprotected in some ways, but underprotected in others. We often have had our choices taken away for our own good, while at the same time not actually being safe from abuse, neglect or poor support. And a rights-based approach tries to hold on to those things together: safety, dignity and freedom. So that's... I've got another question for you, David. Here in Dunedin and in the wider Otago region, disability support can already be stretched. People can feel isolated, particularly if they live in a residential setting, if they have limited family nearby, or if their transport and advocacy supports are difficult to access. What does it mean to have a service like People for Us available in regions like Dunedin and South Otago?
Having a support like this, having a service like this available nationwide, including smaller areas, is very important to us. It means people know they are not forgotten. No matter where someone lives, they
deserve, don't they, David?
Deserve to have someone independent they can talk to.
I think that's hugely significant, David. We know that disabled people outside the main centres can face extra barriers to being heard. Services like that can provide not just oversight, but also reassurance that someone independent and disability-led is willing to come and listen and take our concerns seriously. And because People First is leading visits across Aotearoa, this includes Dunedin, South Otago region, which means it's not something that's only available in the big centres like Auckland or Wellington. It's intended to reach disabled people wherever they are. When we think about the long-term impact of People for Us, what changes do you hope it will make, both to individuals in the disability support system as a whole?
I'd love for more disabled people to feel confident speaking up because they know that someone will listen. That's probably the biggest difference we hope to make. We are already seeing positive outcomes from many people we have visited.
Oh, that's wonderful to hear. The stated outcomes on the service are really ambitious in a good way. The disability support services will learn from the voices and experiences of disabled people in whānau, and the safety and well-being issues will be identified earlier. And that service will become safer and more aligned with the Enabling Good Lives vision and principles. That suggests that this is not just about individual visits, it's about shifting the culture of the service. Is that fair to say?
Yes. Every visit is about supporting one person, but when you bring those experiences together, they also help us understand what's working well and where things can improve. We hope that means disability support services and providers keep learning from disabled people and continue improving the way that services are delivered.
And I imagine there's a broader message here. Disabled people deserve not only care, but accountability. We deserve services that listen, adapt, and respect our rights.
Absolutely. When services listen to people's experiences, they're in a much better position to improve. That's what People for Us is about, making sure people are heard, respected, and supported.
Thank you, Kira. That's really important. For some listeners who think the service might be relevant to them or for someone they might support, how do they get in touch with People for Us, or how do they make a referral?
Getting in touch is really easy. If you think you or someone you know could benefit from a visit, you can make a referral through the People for Us website. If you're not sure whether the service is right for your situation, that's okay, just reach out anyway. We'd much rather have a conversation and see what we can do.
People can find out more, make a referral through the People for Us website, and the service is free to use. The frequently asked questions also explain who can refer, what visits involved, what happens if there are concerns about somebody's safety or well-being. Before we finish, is there anything you'd like listeners to know, especially disabled people in whānau who might be unsure whether to reach out?
Sorry.
Yeah, sure. You don't have to wait before something actually goes wrong. If something doesn't feel right, or you just want someone independent to talk to, please get in contact with us. Sometimes having someone listen can make all the difference. And if there's something we can assist with, we'll work it through together.
Kia ora, and thank you so much for joining me. Thank you, Leanne, David and Kira, and for sharing more about the People for Us service. This is really important work. Disabled people living in residential settings deserve to be safe, to be listened to, and to have the support that respects their rights, choices and well-being. A peer visiting service like People for Us offers an incredibly valuable service, not just oversight, but connection, understanding, and a way to speak up before the problems become a crisis. If you would like to know more about the service or make a referral, you can visit People for Us website for information and contact details. Thank you for listening to DPA's Notable Radio. I'm your host, Amy Taylor. Ka kite anō.
Disabled Persons Assembly is Aotearoa, New Zealand's first pan-disability national organisation, providing system-level advocacy for all disabled people. Membership is free for individuals. If you'd like to know more, visit our national website at www.dpa.org.nz or contact your local kaituitui or community connector, Amy Taylor, at kaituitui.otipoti@dpa.org.nz. Disabled Persons Assembly, a whole new attitude.
This podcast was produced by OAR FM Dunedin with support from New Zealand On the Air.